Good morning, viewers. Today we'll be talking about another aspect of caregiving, and we'll be talking about empathy. So, when we talk about empathy, what do we mean? Empathy simply means putting yourself in the shoes of the other persons. And when we talk about empathy, is the caregivers understanding their fears, their concerns, and things that pertains to them. We should note that sympathy is different from empathy. When we sympathize with them, it's like you're you're pitying them. But when we talk about empathy, that means you understand what they feel and you understand their concerns. Among other persons, it's been noticed that they have their own agitations, they have their own concern, and this part is very vital so that we can make their care holistic. What are the things that are needed when we need to empathize with these adults? First of all, we need to be mindful when we are listening to them. And when we talk about mindful listening, what does it entail? It means you're paying attention to every detail of what they are saying. It's been noticed that when people get old, they tend to ask questions over again, they tend to repeat things, and there's a need for us to be patient with them and listen. When we listen, we're able to pick out some salient things rather than shutting them down. And also, you repose a confidence in them to express themselves freely to us. Another thing we can do to empathize with this older person is simple gestures. When they talk to us, we give them an affirmative answer so that they know that we are following them and they are just not talking to themselves. And another thing we can also do when we talk about gesture is um, giving them warm smile, trying to explain some of their fears to them. There's a need for us to also be aware of our own emotions. Caregivers need to be aware of their own emotions because when we are caring for older person, it's a whole lot of work. So we need to be aware of our own emotions too, so that we can able to respond well when they come up with things they need to share with us or things that bothers them. Another aspect we'll be talking about is also their spirituality. We should note that each individual have one thing or the other that they believe in, and there's a need as they age to affirm their spirituality. By if they are still able to read, we can encourage them. Sometimes you can place faith believing music for them or meditation, which also helps improve their mental well-being. Also, today we'll be talking about myths in older persons. There are a lot of belief out there, and people come up with a lot of myths among the older person. The first one I'll be talking about is that older people are grumpy, the men are grumpy, and the women are tagged witches. People have different behavior even prior to getting old. So it's important to know that when people are old, they can exhibit some behavior, but that shouldn't mean we should term them as witches or being grumpy. Another thing we'll be talking about is that older people should not do any exercises because they are old. When people are old, they should be able to express themselves and they should be able to do exercises according to their capabilities. This is very important because it helps to keep them going rather than allow them stay in one place and you don't allow them exercise at all. Another myth is older people do not contribute to the society. Older people have been shown to have a lot of experiences, word of wisdom that you can't get elsewhere. So when you neglect them, you might not be able to get some information that you as their caregiver don't even have an idea about. So it's important, like we had earlier said in when we're talking about empathy, to listen to them mindfully. Sometimes you're able to get words of wisdom from them, and sometimes experience they say is the best teacher. They have a lot of experiences more than younger ones. I will also talk about a myth that older people do not, when they say older people do not have sex. We've often said it that when they engage in sexual activity, it also helps their mental well-being. So for people who are still sexual active, it's not a sin or a taboo for them to have sex once they have a partner. There's a need to also make them feel active and feel better. Like I said earlier, it's been shown that it helps their mental state and their overall well-being.